Okay, so I wake up from the anesthesia. I realize it's about 11 o'clock, and comfortable. I'm able to move my right leg. The left leg, which I was operated on, had more anesthetic, and not really able to do anything more than wiggle my toes. Get up to my room about noon, thereabouts, after just waiting around in recovery. Whole time I was there with my wife, and get to the room. Room looks like a hotel room. We got dark cabinets, very comfortable. Just lying comfortably in bed, sitting upright. Slowly, I'm getting the feeling back in my left leg. The only discomfort I'm having was like a linear, like a little burning at the incision area. Nothing more, easily tolerable. I know I was getting IV Tylenol at the time. But the pain level, pain is relative, but maybe 2 out of 10. Physical therapy showed up around 3:30 when I had more feeling, sensation in my leg. The whole time I was doing my ankle pumps, quad contractions, and gluteal contractions. Just as an aside, on day 1, I had asked about bringing my leg out to the side and back in bed, with the abduction and adduction, which I was able to do on day 1. I was basically told just do the walking, don't overdo it. Day 2 and even forward, and this is already day number 6, I still really don't have much ability to do that, getting in and out of bed. Really need my arms and my other foot to push my leg over, or outside assistance. So those muscles are weak, but they really weren't being used much before the surgery, so I'm sure that's part of relearning how to walk and move. And I'm walking quite a bit right now, so that's not an issue. But anyway, I sat up. My blood pressure was fine when I was sitting up, no dizziness or nauseousness. I tend to run a low blood pressure. I stood up with the walker. I still felt fine. I did notice, and this is my description, that my joint felt solid. I didn't have any apprehension, and everything felt strong. And I guess in that respect, more solid and strong. I felt like it was more reliable to stand on than previously, where if I had moved in the wrong way, a sudden pain would occur. And even though more recently it hadn't happened, or like 10 years ago when I first started having problems with my hip, I could actually get to a point where I got a sudden sharp pain where my left leg wouldn't support me and I would fall. And that actually got to the point where I couldn't go down steps, or I had to be real careful about the way I walked. So I'd gotten past that point, but periodically I would have sharp pain. I didn't even sense that at this point, even though I knew I had anesthesia. Just everything felt solid and secure. So I walked about 5 feet. I know I felt it was about 10 feet, but it wasn't that far. Basically, I wouldn't say not halfway through, basically a few steps, and I became dizzy, lightheaded, and I knew my pressure was bottoming out. So I quickly sat down in the chair that was following behind me, placing the Trendelenburg, which is lying flat with the feet up 30 degrees to the head, and the head is down. That was done first. They took my blood pressure, and I was about 80–90% feeling better at that point. My pressure was about 90/57, and I was feeling good compared to the way I was before. So I probably bottomed out my pressure 80/40. Part of that I felt was, everyone felt, was due to the anesthetic. Still not having worn off. But that was it for the day, and I did my walking. I got up. Everything looked good until my pressure bottomed out, and got back to bed and running the Iceman water through the pack, and did well. And I was looking forward to having some red meat. Usually don't eat red meat, but I knew I lost about a pint of blood during the surgery, so happily eat red meat rather than taking iron pills. Different ways of getting my iron. And that was day 1. I was offered whatever pain medicines I wanted. I really didn't take anything more than what was being given to me as on a routine basis, which was the tramadol. I don't believe I needed any narcotics. In fact, I did not need any narcotics. I was getting Ancef, which is an antibiotic. I got a few doses of IV antibiotics, which is standard. Unfortunately, I was woken up about 6 times that night, taking blood pressures. Vital signs are taken every 4 hours. Fortunately, I didn't mention this, I did have a Foley catheter, so I didn't have to run to the bathroom, which was very helpful because I wasn't going anywhere. But that made things nice and easy. So that was it. Day 0, operative day. Visited Dr. Ratterman. My wife had seen him at 10:20, right after the surgery. Told her everything went well as expected. They were able to perform the Birmingham replacement, which was a big relief for my wife. You know, I had forewarned her that you can get a total hip sometimes, even though I didn't think I was going to be that. I didn't think that was going to be an issue, but that was a big relief, and that was that. When I saw him later, I told him everything was great, and that was that.
Sorry.